Good evening. I'm Joe Carbonetta, and this is Arroyo Live. This program is produced by and through the facilities of Pasadena Media to help enrich our community through informative and meaningful conversation. You can share your questions or comments with us anytime at arroyolive@pasadenamedia.org. It's been more than a year since schools across the nation began closing their doors to in person learning due to health and safety concerns brought on by the COVID-19 pandemic. In that time, students and parents everywhere have had to adjust to remote learning models as varied in their degrees of success as they were in planning and structure. More recently, circumstances have begun to improve. LA County has, for the past 3 weeks, been stationed in the slightly less restrictive red tier of California's blueprint for a safer economy, an improvement over the most restrictive purple tier, which precipitated the closures and lockdown. Now, as the county sits poised to enter the even less restrictive orange tier, perhaps as soon as Monday, schools are beginning to reopen to in person learning. This evening, we look at the pandemic and beginning the long process of trying to return our children to learning in the classroom. I'll be joined by Allisonne Crawford, president of the Pasadena Council of Parents and Teachers, Brian McDonald, superintendent of the Pasadena Unified School District, and PUSD School Board President Scott Phelps. Stay with us for this week's edition of Arroyo Live. Thank you all for being here this evening. I'd like to go back to the beginning of the pandemic and start out by asking during the period of time when everything was beginning to close down, how easy was the decision to close the school?
So I'll take that question, or I will kick us off. So the decision was not an easy one. It certainly wasn't one that was taken lightly. We had been preparing for the eventuality that we would have to close school for in-person learning, and we were meeting in our emergency operations center, and we had Dr. Go to come by and address the group. And it became abundantly clear to us that we needed to close our schools for in-person learning. The good thing is that we have the infrastructure in place to quickly react to these kinds of situations. So just to give an illustrative example, we went to one-to-one device, student to device 3 years ago, I would say. And so obviously, when this situation arose, it was easy for us to allow kids to learn remotely because they had those devices already. All we needed to do was to provide hotspots to students who did not have them. And we had a partnership with Sprint that allowed us to provide hotspots to students that needed them. In addition to that, because of the skill of our curriculum and instruction staff, we were able to quickly provide the necessary resources to our teachers so that they could provide instruction remotely. And then, in addition to that, the board had delegated some authority to me by granting me emergency powers that made it very easy for me to act quickly in terms of shutting down in-person learning and transitioning to remote learning. So while it was a difficult decision to make, I think we were ready as a school system to make those tough decisions and to transition very quickly and seamlessly into a new way of delivering instruction.
Well, Brian, you mentioned that you were fortunate to have some of the infrastructure in place. Just out of, I guess this raises the question: was the school system uh, ever planning for a scenario such as this? I mean, did anyone in their wildest imagination ever foresee a time where the school might have to close down and everyone would have to learn from a distance.
No, this was certainly not anything on our radar. We obviously prepare for emergencies such as earthquakes and fires and just natural disasters. But you have to remember that the last time we experienced something like this was 100 years ago. None of us were around then. Obviously, I think because we were forward thinking in trying to bring our district into the 21st century, it certainly helped in how we responded to the situation. But we could have never anticipated that this was going to happen and that our kids would be learning primarily from home.
Well, okay, of course, now here we stand a year into this pandemic. There's so much we still don't know about it, but we have learned a few things here and there. And as is always the case, the armchair quarterbacking begins. Certainly, there has been discussion in circles that maybe we did not need to close all the schools, that we were too hasty in reacting. Uh, what do you say to that? Was it the right decision to close the schools?
Is that question directed to me or anybody on the panel? I've
Everybody
been
on the
talking a
panel.
lot.
Oh, I can weigh in. Yeah, Brian, I didn't feel a need to add to what he said before, but yeah, I think that it, decisions like that are influenced by the conditions primarily. Brian and he mentioned the Emergency Operations Center. His team has always worked very closely with Dr. Go and the Pasadena Public Health Department. So they're really going on their recommendation. And that you could fast forward, Joe, to January, just 2 months ago, right? 2.5 months ago, January of 2021. And we had some small groups of students that had, been able to come for in-person services. English learner, people are learning the English language, recent immigrants, continuation high school students at our Rose City campus that they just didn't have the access, the connectivity at home, right? Even despite the distribution of hotspots, obviously there's challenges, a lot of challenges in the home environment. And so we feel that students of lower income, disadvantaged family status, right, foster, homeless, all of these people, all of these students and families were doing worse, right, during the pandemic. And so we had developed these small groups like other districts, right, where the health officials had said you can bring in special education students, right, and certain groups. But I just mentioned that to you, Joe, because in January, what did Brian do? He shut down those pods. Why? Because Dr. Go asked him to, basically, right? And that was because you remember the surge that occurred in the community. This community spread after the holidays, right? So I think he's always relied on the health officials, as far as I know.
Well, I ask the question because I was hoping to hear directly from those on the front lines, which all of you are. Certainly, there have been arguments made in recent months, and again, this is armchair quarterbacking because we know now what we know, and hindsight is always 2020. There's discussion that apparently the COVID-19 virus does not seem to affect children on the level of adults. It is much lower transmissive rates and certainly much less severe infections in children, though there have been some exceptions. But I think it's also important to point out that though the children themselves are not generally as severely affected, schools aren't run by children. There are adults who are highly vulnerable that are in these schools. And I think that's something that's been echoed, a sentiment that's been echoed by a lot of the teachers
Yeah.
unions. And I wanted to
No,
maybe have you speak on that.
Yeah, Joe, it depends on where you are. Depends on your local health officials. And what I mean is how urban the environment is. Certainly there are areas in this country that had schools open in the fall and they've been open, right? But you know, the United States is this huge diversity of experiences, right? And so I think that in Pasadena anyway, and in LA County, you had a lot of concern, Joe, for the children, especially for essential workers. And most of our families are low income, right? And so those children would go home and those people would be working, right, in dangerous environments because they had to, right? And so there was just an increased likelihood, I think, according to the public health officials, of worsening the spread, whereas there might not have been that probability in other locations in the United States. It's true. And you know, there are certain, yeah, I mean, there's studies that show school, like you said, Joe, schools have not been the source or the contributing factor to surges. That's certainly true. They have not exacerbated the spread. There's no evidence for that, right? But yeah, I think one of the things that Brian always said last year was, out of an abundance of caution, he would say that a lot. And we did trust the superintendent and ask it. I'm speaking as a member of the board, had realized that things change very quickly and he needed some powers to be quite nimble in his response. So we knew that he has a very competent team of people. He remarked on making the switch quickly, more quickly than other districts. That is true. And if you talk to people from other districts, that was fortunate, as he said, that we were already, students had devices, but he also had a team, right? A very competent team. So yeah, Joe, I would just say, yeah, I've heard that too. Yeah, different areas politically will respond differently. Sure, you know.
Joe, going back to your last question, I'm speaking on behalf of our PTA Council of Pasadena. And I just want to say thank you to our superintendent because he has partnered with our parent organization, and part of his leadership team has definitely teamed up with us, especially with regard to the technology pieces, so that parents were aware of what the tools were the children were going to be having to receive through their Chromebooks. And so we were able to host a training for anyone who wanted to attend. And so we just appreciate his leadership and that he has partnered with us, and we've been able to team up with our technology officers throughout this entire pandemic. So kudos to your team and thank you so much.
Thank you.
Okay, well, so here we are today, and we are now talking about reopening schools. In fact, as noted, some schools have already reopened. So why now? What has changed that we are now in a position where we can begin to reopen the school?
Yeah, and you know, I've consistently said throughout this pandemic that we wouldn't reopen schools, or I certainly wouldn't recommend to the board that we reopen schools until we thought it was safe to do so. And like board member Phelps said, we have a very close relationship with the Pasadena Department of Public Health, and we're always advised by them. And we, as some people like to say, we follow the science. And so I felt far more comfortable when all of our staff members had access to a vaccine. And this was, again, in large part because of the close partnership that we have with the Pasadena Department of Public Health, and then also through a partnership with the Huntington Hospital as well. So once our employees had the vaccine available to them, my thought was, okay, this is a good time for us to look at reopening our schools. Because again, the issue is always what is in the best interest of our kids. And many of our kids have been suffering at home for numerous reasons. The lack of physical contact with their peers, I mean, being close to their peers and talking to them and interacting with them. And that has affected the mental and emotional health of many of our students. Of course, the other issue is, and this affects primarily our students from low income families, many of them were learning in environments that were not conducive to learning. You for a variety of reasons. And I could list several other reasons. So, so with all of that in mind, my thought was that we should bring our students back on campus. And the good thing about this is that there is choice. So for those families who feel much more comfortable keeping their kids at home, that's quite okay. But for those families who need to have their children in-person learning, interacting with their peers and their teachers, then they have that choice as well. So, those are all of the things that we had to think about. And, I really commend the board for its leadership here. This certainly wasn't a rubber stamp. We had discussions, we had conversations, and the board made decisions that I think will benefit students. And the final thing I'll say on this is that we will bring students back in the fall. We don't know what the conditions will look like, but certainly we want to make sure that we're able to see how things will work out now when students are back on campus so that it will inform what we do in the fall. So there are myriad reasons why, I think, and the board thinks, that now is the time for us to bring students back on campus.
And Joe, as well, from the beginning, we have been trying to abide by the county's relative color-coded status of tiers and the cities, right? You can read locally in the paper where, here in Pasadena anywhere, where we're continuing to have good news going down. LA County as a whole is going down to the orange tier. So that was a part of it too, Joe, is where we had the agreements worked out with our bargaining, we call them bargaining units or labor unions, back in December, intending to open in January, actually, right? That was everybody's thinking, right? But then everybody had to go and hug people during the holidays, right? And so we got this surge and we didn't open in January. So really, we've been wanting to reopen because the pediatricians, for example, anywhere, doesn't matter which associate, which city, which group of pediatricians will tell you, you should get those kids back in school because they're not doing well, right? Socio-emotionally. So we really wanted to open a while ago. So it was just when the holiday surge went down and Dr. Go said, oh, and the governor changed his rules too. I mean, Brian's not telling you, we're trying to keep up with all this shifting guidance from the state. And so we did our best. Brian mentioned it was a difficult reopening discussion because there's a tremendous, I perceived from my position listening to the public comment, there's a tremendous amount of fear about this virus, which is understandable. But from the beginning, we've been talking about mitigation that is layered one over the top, right? As you know, masking, distancing, plexiglass, disinfecting, ventilation. None of them, people, when I was listening to the comment, they wanted 100% guarantee. And that just doesn't exist, right? Guaranteed safety, right? But that's not the way these layers work. Right? The masks block most everything, right? And then, right, the distancing. And so that was really, Joe, the difficulty we had over 2 meetings, the end of February and early March, in terms of setting the date. Because it wasn't a lot of people. Maybe it was about 10% of our teachers and less numbers of our parents that were pretty scared, and it's understandable. But I've always felt like you got to start trying. You got to start trying some things. Even I double mask wherever I go. You know, you gotta. The vaccines are huge. Brian's right. The vaccines, right? Think about that. I mean, amazing how fast these vaccines were developed, right? I mean, it's just pretty amazing, and it provides such a. You know, I'm a science teacher, and Allison, bless her heart, was one of my students, and she's gone on to. Wow. Woo. Anyway, so but I know vaccines are pretty good, are very good, right? So
Joe, from our parents, you know, we just want to be safe. We want to support, you know, our teachers. You know, we have lots of different concerns, and we know that they're slowly being addressed, and so many things are still being uncovered. But you do have kids that want to get back to school, but we want them to know, we want them to get back to school safely, because we don't want to, you know, have another outbreak on a campus, and then, you know, you have to shut down, and, you know, then you miss your friends again. So it's been really nice for the teachers who have set up office hours and just allowed the extra time on Zoom for the kids to get together, and creating the calming spaces and doing some games and the music with the kids and the read alouds. So we've been connecting as much as we can to keep our kids engaged and to really build up their social emotional learning, which I really hope will continue to remain in place when the children do return to school, because that is definitely something that needs to stay at the forefront of our minds, because our kids have been at home for over a year.
And I'll just add two additional comments really quickly. You know, I really must commend our teachers for the stellar job that they've done. They transitioned quickly. They continued to provide instruction based on our diagnostics, our benchmarking assessments. We're not seeing a significant drop off for our kids. You know, obviously, with students at home, you know, the possibility exists that, you know, parents could have assisted, but be that as it may, we're not seeing major drop off in terms of student performance, academic performance. And then I also have to thank our parents, and especially our PTA partner with President Crawford here. You know, we have really worked closely with our parents, and we've listened to them, they've listened to us. And I think that's the great thing about this community, is that everybody's involved, and everybody wants to see the district and our students do well.
And we're so glad that we continued on with Math Field Day. So students were very elated about that.
Oh,
so
that was a great day. I love that day.
Yeah. Yes, it was, even in a virtual setting. So the students were happy.
And in this discussion about the decision to now finally reopen the school, I know that you mentioned following the science, and that there were plans to reopen in the beginning of the year that unfortunately were delayed because of the lack of social distancing, I guess, over the holidays. But just to dispel any myths or rumors that might still be floating around, the decision is not precipitated by parents that are really pushing to get kids back in school because they're anxious to get back to their regular lives as well. Is that safe to say?
Yeah, I've heard that. You know, during our very sometimes animated discussions, really the opposite was true, right? We heard from, we read public comment for, I don't know how many hours, but a lot of hours. And about half of the parents wanted to come back in those comments, and half didn't. But uniformly, the teacher comments, almost uniformly, there were a couple of teachers who said they want to come, right? But uniformly, the teachers were very, very concerned, okay? And so actually the loudest, you know, there's this criticism sometimes that the board is listening to the loudest. Actually, the opposite was true, right? The board heard all of this public comment from the people who were most concerned with, they didn't want us to reopen until the fall. We still voted to reopen. Now, there was a small number in Pasadena, there was protest at City Hall for reopening. But we could tell that that wasn't a lot of our parents, right? That were in that protest that were saying you got to reopen, right? You know, because we could see the protest, right? And we receive emails all the time, right? And so I would say actually we just went with the staff recommendation in the end, right? To that it was safe and that we were prepared and that you know, we were having discussions with our labor partners, which we eventually worked out. You know. Yeah.
Okay. Well, to bring the conversation very local for a moment, let's talk about the plan for reopening. Obviously, the PUSD has one in place now. How is that supposed to work? I guess all of the children are not coming back at exactly the same time.
Right. So our students in the pre-K through second grade will be returning on April the 13th. And then third through fifth grade and sixth through 12th grade will both return on April the 20th. So obviously we have a schedule that will satisfy all of the safety requirements, such as no more than 16 people in a classroom and all of the social distancing requirements, the masking. We will have air purifiers in each classroom that are hospital grade. You know, we'll be doing a lot of disinfecting and sanitizing. You know, so we have all of the safety measures in place. The schedules that we have for both elementary and secondary really, you know, provide some flexibility, but it also provides an opportunity for us to implement our safety measures. So as an example, right after midday or so, all of the students across all the grade levels will leave campus for lunch, and they will go home. They'll have grab and go meals, and so they, you know, nobody will be having lunch on campus. And of course, you know, that's because we had safety concerns about, you know, students removing their masks to eat and so forth. So you know, we've considered just about everything. As a matter of fact, we had an activity at Madison Elementary School a few weeks ago to pressure test our plans. So we had, you know, had tabletop activities, went through different scenarios, and the principals found this and staff found this to be quite useful. So we've given this a lot of thought. We also have the small learning pods that President Phelps mentioned earlier, as well as our Learns program that have been in operation for months. And, you know, there is no evidence of transmission from students to adults. So we strongly believe that we're ready. We look forward to welcoming our kids back, and I think we'll be able to keep our students and staff safe.
Well, with no more than 16 students in a classroom, it's fair to say this is going to be a hybrid learning model where some students will come in on certain days of the week, and then the other remaining students in a class will come back the other days of the week. Is that approximately how that's working?
Absolutely. And what we're calling it the simultaneous model, which means that there will be basically 3 cohorts of kids, because the one thing that we can't do is to have any mixing of cohorts. That's prohibited by the health authorities. So as an example, let's just call the first cohort A. They will be in school 2 days per week for the most part. Then they will alternate with cohort B, which will be in school the other 2 weeks. Mondays will be what's called the asynchronous days, where students will learn remotely with some opportunity to interact with their teachers. And then let's say cohort C, those students will learn entirely in a remote environment. They won't come into campus at all. Obviously, at the elementary level, based on demand, there are some schools that will be able to accommodate students 4 days per week because the numbers and the space will allow that. And then there are other schools that will have to do the 2 day on, 2 day off rotation. Um, our staff has been very creative in terms of, and I have to commend our site leaders as well, our principals. They've done an amazing job of being very creative in how how they schedule students so that students will have the opportunity to continue to learn at a very high level.
And Superintendent McDonald, I want you also to know what else is taking place with your amazing administrators is, during PTA meetings, they will provide their school safety plans and share that out. And so we've had such an increase in attendance virtually. So information is getting out there. So we are very, very glad to hear what the plans are through our, PTA meetings with our school principals. So it's easing, us as parents with making the decision and the choice to have our children come and, to consider what are some of the ailments that, some of our children may be facing. I, for one, I'm a mother, I'm also a foster mother, so I have to think about those things and, those types of considerations. So again, thank you. And I'm glad that we're continuing to have, these conversations and be updated by administration with a plan that we can read, that is color coded, that tells you what you need from point A to point B, and who will be in charge of your child in that pod at that time. So thank you for that.
Thank you.
In your recent example of the way the kids will be returning, you mentioned cohort C. They're the group that will be distance learning exclusively. Is that a group that would be assigned by the district? I mean, will the school system determine those people that stay home, or are these students whose parents have elected not to return their children yet based on safety concerns?
Yeah, it's based on a survey that is been ongoing survey, and our staff and the PTAs have tried to get people to answer it, and tried again and tried some more. And called people and asked them, no, it's choice. As Dr. McDonald said, we have a lot of choice, right? In the matter. No, we're not choosing in terms of if we're not determining what the families want to do. They're determining that.
I have to ask this question, perhaps anecdotally. Does this distance learning ability put an end to the sick day for students in schools everywhere? I mean, can you no longer say I couldn't get to school?
Yeah, it certainly should. And why they're giving out attendance awards, we question that as parents.
Yeah, I think, well, Joe, on a larger, you're opening the door, I think, I think it would be a healthy conversation to look at how education could change in a positive way as a result of this, as Brian said, as far as I know, completely unexpected pandemic. It could, there's some healthy ways. I mean, as you know, there is various forms of alternative education that goes on already in the 21st century. We have a Center for Independent Study, for example, in our school district, right? That's not new. That's been for several decades over on the campus of Pasadena High School. So when I think of that, Joe, I think of who is it, right? The conversation will be about who is it that can do more independent work, right? Which kinds of students? Now that's an interesting conversation, right? It has many aspects to it: parental support, just motivation. One of our principals, the amazing Dr. Lawton Gray at Muir High School, just talked about the effect, right? The people effect, right? Of being in person with teacher and students. It's a huge effect that I think the flip side of what you're asking, Joe, is I think we're going to realize what a huge effect that is, right? The person, right? The connection. I think it's pretty big. I think that in terms of motivating some youngsters, it's really important to be in person,
Okay, well, moving back to a more serious line of questions. Uh, Earlier, we discussed some of the safety protocols that are being put in place for the students that are returning. Is COVID testing part of those safety protocols? And if so, how frequently?
That's a superintendent question.
Thought you were going to take it. Actually, yes, we have a very robust testing plan. And the state is providing, uh, a certain number of tests for the district. So in other words, they've contracted with Valencia Lab, and we have a certain number of slots, so we can submit our tests to the lab to have them analyzed. Also, we have a partnership with our healthcare provider that will allow staff members who have insurance in our district to also have frequent tests. Now, the board, taking safety seriously, has mandated that we test students and staff every week during the month of April. And so we are putting those plans in place. We have a schedule. We've brought on some contract nurses that will, in partnership with our nurses on staff, go around to the different school sites during certain time periods and provide testing for students and staff on a voluntary basis as asynchronous testing. I'm sorry, asymptomatic testing.
How easy is it to test some of the younger children? I can imagine that that's a complex issue to try and deal with.
Right. Yes. It's, from what I understand, I've never taken the test, but it's quite uncomfortable to have something stuck
It goes way up your nose.
Right. Yeah. So
I've had it many times. Yeah.
But this is why, testing for the most part is voluntary. It's asymptomatic testing, and parents and staff can actually administer the test at home. If somebody is displaying symptoms, then we are requiring them to go down to our clinic to be tested. So, that takes care of the issue of the young child who might find it very uncomfortable. Their parents could administer the test at home.
Well, this brings me to the next obvious question. What is the protocol? What happens if you have a confirmed positive case in the school?
So if we have a confirmed positive case, then we are mandated to report this to the authorities, who will then provide guidance for us, which might include, or probably will include, mandatory quarantine for those people who have been exposed.
Yeah.
And of course, we do have a dashboard on our website where we report positive cases. But for the most part, we contact the public health department, Pasadena Public Health Department. They will do the contact tracing and all of those kinds of things. All we have to do is provide all of the information to them. And our nurses are also, and our principals are trained to perform contact tracing. That would be outside of the scope of duties for principals, but our nurses are perfectly capable of doing it. But all of this really is done in partnership with the Pasadena Public Health Department.
Yeah, so Joe, we have voluntary, as Brian said, asymptomatic testing, even for our athletic groups, which are Thankfully, our athletic groups are back in action because the kids love it. And we had a case, just to illustrate the protocol, Joe, a couple days ago where a student athlete had tested positive. So the protocol kicks in where our director of health programs and staff that is working on the contact tracing have to contact everybody within a certain number of hours. It's required, right? And then obviously they already reported it to Pasadena Public Health, et cetera. Now, and Brian and his team work with Dr. Go, at the director of Pasadena Public Health, because that 10-day quarantine that he's talking about is really, she's saying that has to happen now for all of those, let's say, baseball players, right? Now, I know this because it turned out that the student who tested positive, mother was a nurse, so he went and had another test and it wasn't positive. So, but I'm just telling you how serious this is, because even though that one wasn't positive, Dr. Go is still saying, as far as I know, I don't care. You still have to treat the same one as the first one as positive. And so the parents aren't too happy about missing more games, I can tell you that. So, but yeah.
Well, early on in the pandemic, we heard reports that personal protective equipment, the PPE, was becoming very, very difficult, if not impossible, to come by. Where are we now when it comes to PPE? Obviously, the teachers and all staff are going to need to have those. Students as well that are coming onto campus. Are they still in short supply, or are the schools pretty well taken care of where that is concerned now?
The schools are very well taken care of as far as that is concerned. I have to commend our business department, and especially our procurement department, because we were never in short supply of PPE. We always had enough on hand to satisfy our needs. And so, and that is in large part because we did get some supplies from the county, but we ordered very early, in the early stages of the pandemic. We went ahead and ordered supplies knowing that it was going to be in short supply. So thanks to the foresight of our CBO, Dr. Leslie Barnes, and her team, we got out ahead of this and ordered the supplies that we needed, so that our students and staff will be protected, because we have all of these PPE available to them.
Okay, well, so far we've talked about actually opening the schools and what it will look like when the students return, that there will be significantly reduced numbers of students on campus at any one time. But what about getting students there? What about the students that traditionally rode a school bus to school? Will those buses be available, or is it now every man for himself when it comes to trying to get to school?
No, again, it's the foresight of his plan. He has quite a team of people, right? And then his leads, is what we call them, chief officers in each department, have their own teams. So the board recently approved contracts for transportation for what you're talking about, that were brought before us as required for us. It's required that we approve that. But Joe, I can tell you that those are primarily, overwhelmingly, for two purposes. Special education students who have transportation as a part of what's called their individual education plan, which is a legally required plan, and athletics, athletic outings, right? Trips, athletic events. We just over the years have decreased our busing of other students, Joe, like, just what we call them general education students. We just don't have that. We just didn't have that anymore before COVID. Yeah, certainly secondary students, we we have at times provided bus passes, but that's not on, buses that we contract with, right? Those are just like bus passes with the local bus system.
I'm sorry,
The
Allison.
challenge for parents right now is the transportation issue, because we have parents who are caring for nieces and nephews, grandchildren, foster youth. So it is definitely a topic that we want to know, how is our district moving forward with transportation. And then of course, if you lived in a portion of the district that never offered transportation, what are you doing if you don't live close enough to walk to a bus stop? What then do you have access to? So that is a huge conversation for families, especially for those who may have downsized their cars because of a job loss and income. So there's a lot of different considerations. And again, this is the time when parents are teaming up, and you really are getting to know your neighbor to say, hey, what situation are you in that we can figure out how we can tag team to get our kids to school or pick them up, especially if we know, there's not that lengthy after school time for childcare. So what then are those options, for our families who need it? So I'm glad to know that the district is having these conversations, because we certainly are having them with our parents and each other.
Well, Scott, a moment ago you mentioned, with reference to the transportation issues, the special needs students, students with disabilities, all of those students in general. Um, Throughout the pandemic, and especially with the distance learning model, we have heard time and time again that the students with special needs have largely been left out of the consideration. Maybe that's an unfair characterization. It's just that since the planning wasn't there, because this issue had never been considered, uh, they were slow to ramp up programs that were suitable to students with special needs. As we return to in-person learning, are we trying to address those students more completely in the coming months?
Yeah, so one of the small pods that was, small pod concept that I mentioned during the many months of shutdown for most students, or shutdown of in-person, that was one of the small groups that were allowed under county regulations, right? And so staff was working on developing those. I'm not sure they were actually deployed because of the surge. There might have been some special ed pods. I'll ask Dr. McDonald. But what I would say to the opening, of your statement, Joe, is I know a lot of special education teachers. So they were continuing to teach, right, remotely, looking at their lovely faces on their screen. But I think what you're referring to is a lot of our students have instructional aides, right, that are with them closely in the classrooms. And certainly the in-person assistance provided by aides was not happening during COVID. That's true. And to that extent, they were lacking what they were used to before COVID. But I'll turn it over to Dr. McDonald too.
Yes. Right. So we've had the small learning pods. We actually tried to get them established prior to the surge in December, and we couldn't get them off the ground because of that.
Mhm.
Now, the small learning pods are designed to serve students that have more significant disabilities, or more severe disabilities, I should say. Um, so students that are, for example, learning disabled are generally integrated or mainstreamed into the regular classroom with support from an RSP teacher, or an instructional aide. And so those students, we did not have learning pods for those students, because we thought that we could serve them through our regular remote learning platform and strategy. So, I think that we've made every attempt to satisfy the requirements of those individualized learning plans. Uh, Obviously, with some of the restrictions, we haven't been able to provide in-person services, but we've tried to um, serve our students the best way that we could, given the restrictions.
Okay. What is the current rate of vaccinations for teachers? Certainly, we've heard that teachers and other childcare workers have if the door has been open to them to get vaccinations. How receptive have the teachers been as far as getting these vaccinations, and what is the penetration of vaccinations in the PUSD?
So we don't have accurate information on that, and the reason for that is that the partnership with the Pasadena Department of Public Health, the district, and the Huntington Hospital did not allow us to collect any data because obviously uh, educators were able just to sign up and go and receive the vaccinations through the Huntington Hospital. We did, however, have our medical pods through which we administered vaccinations to some of our employees. Um, and so we were better able to track how many were administered through our MPODs. Um, I do believe, however, that at last count, several weeks ago, we had vaccinated approximately one half of our 2,400 or so employees, and I'm fairly confident that that number is much more than what it was a few weeks ago. So again, every single employee has had the opportunity to receive the vaccinations if they so desired.
But the school district is not actually requiring employees to be vaccinated.
We can't do that.
We actually received, the board members received a letter from the anti-vaxxer organizations, right? And this wasn't the first time. I remember when the flu shot, right? They told us even about the flu shot. So yeah, but I think that that's a little distress. As a science person, I'm not very pleased with that. But I think most, Joe, it's a pretty high percentage of our staff. I think there was a enthusiastic response to the vaccine. So it's very high. It's getting pretty high. Yeah.
Well, we only have a few minutes left in the program, and I would like to ask a question that I'm hoping I can get a response from each of you, your opinions on this. There has been a lot of back and forth discussion recently about how detrimental it has been to students across the nation to have been out of the physical classroom for the last 12 months. I'd like to ask each of you your opinion. And again, we only have a short amount of time left, but if each of you could tell me your thoughts on how much of an uphill battle do we have as we bring our kids back. And I guess I will start out based on how you all appear to me on this Zoom session. So, Brian, if we could start with you, I'd like to know your opinion on that.
Certainly. The one thing we have to keep in mind is that children are resilient and they have a significant capacity to learn. We hear the term bandied around learning loss. The students haven't lost anything. Maybe learning was paused. But in our local setting here, our teachers have done an amazing job of continuing to teach our students, albeit remotely. And so I do, and of course, our curriculum and instruction department, led by our chief academic officer and our assistant superintendent of curriculum instruction and professional development, have worked very diligently to modify the curriculum so that what's being taught are those standards that absolutely must be taught, the power standards. And by pulling those standards out and teaching them, we can easily build on those standards in the upcoming years, so that whatever gaps exist can be closed. So I have a lot of hope for the future. I think we're very well positioned to accelerate learning for students, so that all those gaps will be closed and they'll be back on track.
Okay, Allison, I know that you have to be leaving us shortly, so can I get your opinion?
Well, certainly, as Superintendent McDonald has said, that there has definitely been a pause in learning, and it's noticeable. If you're at home with your children, you notice what the learning pause has been, and if your child had deficits before, they're exponential in your face, at this moment. So you're very, very much aware. But PTA Council, we have done things. We hosted a parent professional development day for families. We partnered with Lakeshore in the community. We provided, math manipulatives and different types of bags and educational supports for families. So, we've been able to step up as much as we can. We've received a grant through National PTA for $15,000 to help support distance learning, and been able to generously support some of our teachers with training programs. So again, at this time, there definitely has been a pause, and we definitely need to continue tutoring supports with in-home services, for the kids, and to stay online. And I really hope that more of the instructional technology really becomes a part of the children's learning as they return to school, as they have spent so much time online right now. They really should be more efficient at using the computer. And so I hope that, we build on these typing classes and Excel and PowerPoint and all the different training tools now that, teachers have had to use. Some by choice and some by being voluntold. So again, I hope that becomes more of, what our children are doing, and that they have a platform to share more about what this experience has been, and, to document it, because it has been harsher on some children than others. Like Board Member Phelps said, if you have the support there, great. But for those that don't have it, what is that going to look like for them to return to school and be able to continue to thrive? So as a parent and an educator, I'm definitely concerned, and as so many of us are, but we will just continue to communicate, collaborate, do the outreach, and step up where we can to help support our children.
All right. Allison, in case you do have to leave, I want to thank you for joining us this evening. And Scott, the final thoughts
Thank you.
are yours, please.
Yeah, I think that children are the improvement in their socio-emotional state that's going to take place is going to impact back on their learning. So when they're able to be with their peers and with their teachers, I think that's gonna help them get back in the sync, and there is going to be sort of this surge of from that reconnection, because it really has been a weird thing, right? It's really weird. So human beings are wired to connect, right? Even in our brain, right? We're wired to connect with other people, and so I think that Brian said we're going to be surprised that kids are going to rebound very well.
All right. And with that, I'm afraid that we've reached the end of our program this evening. I would like to take this opportunity to thank all of my guests, Ms. Allisonne Crawford, Mr. Brian McDonald, and Mr. Scott Phelps. Thank you so much for being here this evening and for sharing your thoughts and information with us. To our viewers at home, if there are topics you would like to see addressed in our program, you can email them to us at arroyolive@pasadenamedia.org, and we may include them in a future broadcast. Until next time, this has been Arroyo Live. I'm Joe Carbonetta. Thank you for watching, and good night.